So, good morning everyone. So, I'm here to talk about the types of the bite of animals and the types of the one. One. So, the first is types of one. So, first is abrasion. So, an abrasion occurs when your skin rubs or scrape against a rough or hard surface. Road rash in example of an abrasion. There usually not a lot of the bleeding, but the one needs to scrub and clean to avoid infection. So the next is laceration. So laceration is a deep cut of tearing your skin. Accident with knives, tools, and machinery are frequent causes laceration. In the case of deep laceration, bleeding can be rapid, extensive. So the next is puncture. So puncture is the small hole caused by a long pointy object such a nail, needle, sometimes a bullet can cause puncture one. So the last is the avulsion. So avulsion is the partial of complete tearing away of skin, the tissue beneath. Avulsion usually occur during event of violent accident such as a body crushing accident, explosion, and gunshot. They bleed heavily, rapidly. So the next is the first aid for the open ones. So first is the stop bleeding. So stop bleeding. The minor cuts scrape usually stop bleeding or their own if the needed. Apply gently pressure with a clean bandage or cloth the elevate one until the bleeding stops. So the next of the first aid of the open one is the clean the one. So clean the one, rinse the one with water, keeping the one under running tap water will reduce the risk of the infection. Wash around the one with soap, but don't get soap in the one, and don't use hydrogen peroxide or iodine, which can be irritating. So remove any dirt of debris with tears, clean with alcohol. See a doctor if you can remove all debris. So the third is the apply an antibiotic or petroleum jelly. So this one is applied in a layer of an antibiotic ointment of a petroleum jelly or to keep the surface moist. The help prevents scarring. Certain ingredients in some ointments can cause a mild rash in some people. If a rash appears, stop using the ointment. So the fourth is the cover the one. So to cover the one, apply a bandage or any other cover the one that held in the place that with paper tape covering the one keeps it clean. So if the injury is the minor scrape or scratch, leave it uncovered. So the fifth is the change the dressing. So change dressing. Do this at least once a day or whenever the bandage becomes wet or dirty. So the second to the last of the first aid for the open ones is a get a tetanus shot. So if you haven't had one in the past 5 years, the one is deep or dirty. So the last is watch for the sign of the infection. So see a doctor if you see sign infection on the skin or near one, such as redness, increasing pain, drainage, rump, or swelling. So the third is is types of shock. So the the first of type of shock is cardiogenic shock. So Jude, heart problem. So in this example is the high blood. So next is the hy- hypovolemic shock caused by allergic reaction, caused by too little blood volume. Sorry. So the third is anaphylactic shock. So caused by allergic reaction. So the second to the last of type of shock is septic shock. So due to the infection. So the last is neurogenic shock. So caused by damage to the nervous system. So the fourth is first aid shock. So lay the person still down and elevate the legs and the feet slightly unless you think this may cause of pain, further injury. So the second is the keep the person still and don't move him or her unless necessary. So the third is begin CPR if the person show no sign of life such as not breathing, coughing, or moving. So in the fourth, loosen tight clothing and if needed, cover the person with a blanket to prevent chilling. So the fifth is don't let the person eat or drink or anything something else to do the person. So next is the if you suspect that the person is having an allergic reaction and you have to access to an epinephrine autoinjector, use it according to its instruction. So for example, this one is the nurse can the doctor give advice the patient to know it to how to use the medicine. So next is the if the person is the bleeding, hold pressure over the bleeding area using a towel or sheet. So the last is if the person vomits or begins the bleeding from the mouth and no spinal injury is suspected, turn him or her onto a side to the prevent choking.
On the three go.
So the fifth is the animal bites. The animal bites and scratches that break that skin can sometimes cause infection. Some bites need stitches while others heal on their own. Really, bites from the wild animals such as can lead to rabies, a life of threatening infection. So this one of example that the animal bites can cause rabies is bats, raccoon, skunks, and foxes cause most rabies cases in the forest or any other places that can place that surround dirty places that animals can cause in rabies. So the number 6 is the first aid for the snake. So first thing to do to know the how to first aid the how to pre- how to how to first aid the biting of the snake is lay or sit down with the bite in the neutral position of comfort. So the second is remove rings and the watches before swilling start. So the third is wash the bite with soap and water. So fourth is cover the bite with a clean, dry undressing. So last is mark the leading edge of the tenderness swelling on the skin and the right the time alongside it. So, first thing to do to bite the snake, uh, don't be panic because did you don't be panic so can panic this uh, the the biting of the snake is cause of death. So the next is the first aid for dog bites. So first is wash the bite area with soap and the water. If the bite is bleeding, put the pressure on it using sterilite gauze or a cloth clean. So second is if the bleeding has stopped, put the antibiotic ointment on the area. So the fourth is cover the area with a bandage or sterilite gauze. So lastly is if your child has pain, give acetaminophen or ibuprofen. So that's all. Thank you.